Welcome to today's episode. We were diving into the fascinating world of TCM clinical practice, exploring the interesting cases, challenges, and also memorable the patient experience. Today, we have Dr. Ting-Yu Huang, a TCM doctor from China Medical University Hospital, here to share some amazing stories with us. 欢迎收听今天我们的节目，我们将深入探讨中医临床诊断的世界，来了解医师们在诊间当中遇见的一些趣事、挑战和难忘的案例。我们今天邀请到黄廷宇医师呢，他在我们中国医药大学附设医院拥有丰富的临床经验。那么今天来跟我一起分享他一些精彩的一些临床诊疗的经验故事。欢迎。
嗨，各位听众朋友，大家好。
Okay. Could you briefly introduce yourself and also share why you choose to become the TCM doctor?
So I'm Ting-Yu Huang, and I currently work at China Medical University Hospital, the TCM department, acupuncture department. So previously, actually, I did not major in medicine when I started university. I was studying photonics, and later I mastered in physics.
Ooh.
And so after that, I was thinking about what I was going to do with my life. And so one of the options was to become a doctor, which is a common option chosen in Taiwan.
Mm-hmm.
So, I wanted a stable life. And I saw my advisors in the physics department. They had to fly around looking for jobs all around the world, and that was not what I wanted to go for in the rest of my life. So I chose to switch to a more relatively stable environment. Yeah, but I think there are still some things that are left over from passions in physics, which affect how I think in medicine.
But of course, to become the TCM doctors, you need to study the TCM. Yeah, I think for the post-bachelor, the study should be 5 years. And also needed to have the, clinical observation for Western medicine and also internship, the clinical, clinical internship for the TCM. Yeah. So I think you have a lot of experience for this kind of, the treatment. 所以我相信其实学到中医系大概念5年，那当然要经过西医的见习，还有中医的实习，那当然还有很多临床经验，所以这个就是您今天来跟我们分享的最重要的一个基础。And also have another cases you want to share with, maybe you have some kind of, surprise or challenge that you made, maybe something special, the cases you made.
Okay, so as a TCM doctor in acupuncture, we sometimes we have to go to take care of patients in the emergency department. So, as everyone knows, in Taiwan, emergency departments are like grocery stores. They are very, very stuffed with people. So sometimes there are just a lot of people stuck there who cannot get out due to some minor problems. And these minor problems, if we can help them with acupuncture, then we would reduce the queue in the ER and save space for those who really need, are really in emergencies. So I go to the emergency department for 2 sessions for every week, and sometimes we approach some cases. Usually in the emergency department, we have 2 types of cases. One is muscle or musculoskeletal pain related problems or dysmenorrhea problems, or well basically the pain category. And the other category is dizziness, and mostly dizziness. And when we approach these patients, because they usually have most of them maybe have no history in CMUH in any TCM records. And like maybe around 10 or 5% of people even have never had acupuncture. So for these people, it is very challenging because you have no idea what to expect when you perform acupuncture on them. And you have no idea of their baseline status because they are a totally fresh case.
Oh.
Yeah. So it is very interesting in the sense that I would have the chance to see for a fresh case and using a diagnosis method learned in school, what the probability this diagnosis method really works.
Oh.
Like, for example, at school, we are learned that, okay, you can diagnose a person based on post-diagnosis or based on some symptom differentiation, pattern differentiation methods. And based on these pattern differentiation methods, we perform acupuncture and assume that this method will treat the patient. And the interesting thing is with these patients with dizziness. So initially, when I went to the ER, I thought that, okay, at school, we are taught that using pattern differentiation combined with post-diagnosis, I expect that if I modify using acupuncture, I modify the pulse into what we call normal pulse. In Chinese, we call it 平脉，就是正常人的脉象。Then I would expect the symptom to disappear. So that is now I consider this sort of like a belief, because at school actually we are taught this thing in a way that wants us to trust that it works. I recall this how I studied it, and I think, okay, I think I just trusted it. So, but when I really have the chance to test it out on these patients, well, practice it on patients, not test it out, practice this on patients, then I find out that it works quite well. At least in like 60 to 70% of the patients, if you modify their pulse to what we call a normal pulse, then their symptoms will be reduced immediately to around half. So if initially they have we usually use a score called visual analog scale called VAS. And for example, if a patient has an initial VAS score of 6, then you would expect on average after your treatment, it would be reduced to 3. And the treatment session is usually, we would perform acupuncture and leave the needles for around 20 minutes. So the treatment session is around half an hour. So for half an hour, you would expect effect of reducing the symptoms in half. And this works for like 60 to 70% of the patients with dizziness. So the first part is that, okay, it proves that it works. The second part is that it tells me that, okay, for the 30 to 40% of the patient, it does work. And that is the part which is still challenging to me. So so in medicine, we need to find new ways to treat the patient when you don't know what to do. So that is still the challenging part for me.
Yeah, but you can imagine, you can see that TCM doctors make a post-diagnosis in the ER. Normally in the ER should be very, everything should be very quickly, and it should be very, hurry to do it. But, the TCM doctors are always very elegant to take the poses for the diagnosis. This kind of pictures could not image. So that time, what kind of feeling you have? 就是在急诊室真的是很赶很急的时候，那中医师这样的把脉又很优雅的把脉，不是就很奇怪吗？你那时候的感觉是如何？
老实说，其实不会非常的奇怪啦，就是应该说我们会收到的病人群比较会是没有那么急的病人。
OK，
就是真的像是有一些中风，那可能要去紧急做一些导管或是打一些静脉注射剂的病人，其实就比较不会会诊中医，对，因为他可能会及时有一些需要立即处理的状况。对，那如果我们这时候把病人身上留着针，就会很尴尬。
I see. Yeah. So now, in our China Medical University Hospital, even in the ER, we also emerged, the Western medicine and also Chinese medicine to treat the patients in the first and also priority, the treatment. Yeah. So today is welcome to really thanks to give us this kind of fascinating, the sharing experience. And how can we find you if some people want to looking for your help? So they just go to our China Medical University Hospital and to book your clinic for conservation or also for the treatment, right?
Yeah, you can just go to our CMUH website, and on our acupuncture department, you can find a place where you can make a reservation.
Yeah. 哇，所以谢谢今天我们的黄医师呢，我们中国医药大学附设医院中医部的黄医师呢，那他本身也是在我们针灸科的住院医师。那如果你有需求的话呢，欢迎到我们中国医药大学附设医院的网站来直接搜寻他的诊间的挂号资讯就知道了。Okay, so thank you very much for today for your sharing. Thank you very much. Thank you.
Thank you.
Okay.